Hey beauties, it's Rain and welcome back to my podcast, Unfiltered Beauty. Today on my episode, I do have an amazing guest. Her name is Dr. Rachel Pearson. So I'm going to let her introduce herself.
Oh, Rain, thank you so much for having me. I love that you're doing this work, this podcast work, this storytelling work. I think it is so important for building a better world for everybody, that we are sharing our stories and sharing about our lives. So I'm a pediatrician, and I am one of the project leaders for HIV Out Loud, which I'm really excited to talk about today. I also, I write, and I'm the Humanities Director at the Cheever Center for Medical Humanities and Ethics. So I get to do a lot of cool humanities work and storytelling work, and HIV Out Loud is a huge part of that.
Nice. I think what you're doing is amazing. So thank you so much for the work that you do. You know, last year when you reached out to me and invited me out to meet your students and meet you and be part of this amazing HIV Out Loud program that you created, that y'all have put together at, oh my God, I just said UT.
Yeah,
Sorry,
it's okay.
Okay,
It's okay.
Okay, make sure. Sorry, guys.
It's in the curriculum.
Okay,
It's part of
okay, want to make sure.
It's part of our institution. We're proud of it.
Okay, awesome. Yeah, you should be. That is like really awesome. And you know, getting to meet you and the students and getting to talk about the experience, like I had mentioned in your when I joined y'all, I'm someone who is not living with HIV, but I was affected by it because my little brother, like I mentioned in before, like his history. That's how I got involved in being part of the HIV community. So thank you so much for putting this like platform for students and the education behind it. I feel like it's very important for people. So like that, as a whole team, as a community, we need to end the stigma, and I feel it starts from classrooms. Yes. It really does. It starts from classrooms, and if you have professors, doctors who are very educated and willing to have an open mind and share that knowledge with students about what else is out there, just to compare to, I'm not a medical student, but I'm sure like sometimes students are learned what is just like the basics. Mm-hmm. And I feel like HIV is not like the basics. It's more something that as you go out there and learn it. So thank you for what you do.
Oh my gosh, it's such a pleasure. Honestly, so we started this project back in 2020. It was inspired by the End Stigma End HIV Alliance, who had an amazing storytelling event called Raising Our Voices. And 4 storytellers who were living with HIV told their stories on stage at the Guadalupe Theater. And that night really showed how incredibly powerful storytelling can be for combating stigma. So the idea came out of the community. And we built HIV Out Loud, to be a storytelling project, but that's housed at the medical center, right? And the reason for that is because so much of the stigma that people living with HIV encounter is in healthcare spaces. So like the Pride Center of San Antonio and Trinity did a study called Strengthening the Colors of Pride back in 2020. And they found that 40% of the LGBTQ community here in San Antonio had trouble finding adequate health care. 46% of people had delayed seeing a healthcare provider. Almost 20% reported having been assaulted in healthcare.
Oh, wow.
Yes. So when you hear statistics like that as a doctor, you feel shame. Like that absolutely should not be anyone's experience in healthcare. And for me, being part of HIV Out Loud has, helped me kind of work through some of that shame, because it's like together we are trying to make stigma-free healthcare spaces, and we are trying to build up like our future doctors who have learned directly from people like you who are advocating in the community and have learned directly from people living with HIV, so that they care about the stories, they care about the people, and they feel connected to the community.
It's definitely, I think it's definitely amazing what the work that it's also a safe space that y'all created, because like you said, like these advocates that we get to come here and make sure that hey, your story is important as just anybody else, and it's a safe space to talk about it. It's an amazing platform. It's a very, I know, like, working out in the HIV community, and it's hard for a lot of us educators to go out there into like schools. It's really hard because of like parents and like the board members, just everything like makes it a harder barrier for us to go and talk about education of HIV. So for HIV Out Loud to be created is such a huge milestone in the education. For me, as somebody that gets to experience those barriers that I get to see all the time, it's a really huge stepping stone, because we may not have the education to go into like public schools, but at least we get to start where the doctors, the future doctors and providers. So I think that's amazing what you're leading with HIV Out Loud, and it's amazing that I get to be part of it with you, and like having as being the first one as your guest speaker.
Can
was
I
pretty
talk
awesome.
about that night?
Of course.
Can I talk about that night? Okay, so a couple things about you, Rain. Not only were you the first speaker in the course, but you were one of the first storytellers to share your story with the project back when we were just starting and we were just beginning to figure out how to do this storytelling work. So you recorded with Brittany Hansen at World AIDS Day back in 2021. And
that was a fun experience.
I'm glad it was. I'm glad it was. And then when I reached out to you, like when we talked on the phone, even a couple years later, you were so ready to contribute, to share, to be part of the project. And that generosity, like I have experienced over and over that kind of generosity from the LGBTQ community here in San Antonio and from the community of people living with HIV. Like, people are sharing their stories. They want people to know that lives lived with HIV can be full of joy and connection, right? And there's loss too. Like, these stories, you know, people talk about loss. You know, you shared the story of your brother, which is so tragic. But at the same time, even in the story, you talk about how, you know, like the concept of the phoenix, right? So people who experience suffering, how you can rise up from that changed, and how you can rise up from it and be able to make a difference in the world, which I think is like the difference between, for my students, the difference between learning, you know, that HIV is a virus that infects the cell in this way and you can use X, Y, and Z medicines. The reason between the difference between learning that, what you might learn in the traditional medical curriculum, and then hearing directly from the lived experiences of the community is huge. I hope and I believe that it's going to create physicians in all kinds of specialties, because my students are going into all kinds of different specialties, but it's going to create providers who are ready to meet people where they're at with that spirit of warmth and generosity.
Yes, it is like when being part of this and being to advocate for everybody, not just the HIV community. It's very important because we also have to advocate not just for our clients but also our loved ones. But like the example, like this, like the reason why, like, me becoming advocate, because I know there's more family members like me out there that are going through that hard time of accepting their loved one passing. And like I said, I'm not living with HIV, but I was affected by HIV because it cost me losing my brother. And I want people out there to know, like, hey, there's support groups, there's people like me that it's okay to talk about. It's okay to express your feelings and how you feel, and it's okay to, if you're someone who is not who don't understand how the virus works, like, it's okay to talk to us and reach out and ask for help. At the end of I think for me, at the end of the day, it's making sure that you take care of your mental health as well. Because even though that your loved one may have passed and they were suffering as well, you suffer as well, because they don't get to see the aftermath after they're gone. And that is what happened with me. When I lost my brother, I spiraled really bad. I was going through the darkest moments, And if it wasn't for one of my best friends, Ray, being there for me, I would have lost it. And Mario as well. When I met Mario, it helped. Having them two in my life just really helped me mentally, and helped me get more involved in our HIV community. And it helped me because I got to share an insight of a difference of someone not living with HIV, and the aftermath, how it affects a loved one.
Exactly.
And that's why I dedicate my life so much to the HIV community, because I want others out there to know, hey, there's people who actually care and love you and accept you for who you are. I'm not afraid of HIV. And I've mentioned this to many of my friends. I was like, if that day ever comes where I happen to contract HIV, I'm not afraid of it. Mm-hmm. I'm very well educated about it. Right. I know how there's medication out there, and now with the new medication like Cabanova is the injectable one. Now you can take it 2 months. I went to DC last summer during Pride Month. I was invited by an organization, and I got to advocate for how important Cabanova is for our houseless community. Mm-hmm. And so, in getting to educate going into talking to these people that are making policies, hey, this is important medication. So I want our community to know hey, there's so much help out there. There's so much education and resources that don't be afraid of asking for help. If you're someone who's listening who if any of my people listening out there that you're not understanding HIV care, or understanding hey, is there help out there for someone who has lost somebody living with HIV, hey, reach out to us. Our DMs are open. We are open platforms. We're here to help our communities. I think as working as a team in our especially in the healthcare, is how we're going to be able to break down those stigmas.
Absolutely. Community is so important, and I think when I think about your story too, one of the things that it shows is not just how community helps you rise up and helps you be safe and be healthy, but also that we're all really connected, and so you may or may not be living with HIV, but your life can still be deeply affected. And to share that story, for anybody to hear, I think is really important, because like you said, you mentioned stigma, and stigma, when we think about HIV, it's a barrier to people knowing their status because they're afraid to get tested. They don't know that there are medicines that are so effective that your viral load will be totally undetectable and you won't be able to transmit HIV. Agreed. Even if you're affected by the virus, right? People don't know that. They don't know that lots of people living with HIV are living long, healthy, wonderful, connected, happy lives.
And some are having kids. I know,
exactly.
As you as a doctor, I know, I'm sure, do you ever have patients that are living with HIV that are women?
Yes, absolutely. So actually, it's one of the most amazing things about my practice. I work in the newborn nursery for part of my job, and I get to care for moms living with HIV at the time of delivering their children. And, some moms are still in the thick of trauma, still newly diagnosed, may not be on medication. And for them, the time of having a baby can be a time of actually really getting connected to care and really getting connected to resources. But another part of that story is, in 2025, getting to be there for moms who have been, had their HIV has been well controlled throughout the pregnancy, their viral loads have been undetectable, and the risk of their infant being affected is vanishingly low. So being able to just say oh my gosh, you worked so hard to protect this baby through this whole pregnancy and look how healthy this baby is. What an incredible thing you've done. Right.
These moms are lucky to have you as to you're their angel. I'm sure it makes them feel so much at ease and peaceful that, hey, my baby's going to grow up to be healthy, able to have a good life as well, because that stigma does really affect,
yes.
I've had, as my career, I'm a case manager, mm-hmm. And I work with everyday HIV patients. So I've had clients where I've had mothers that are afraid to get pregnant, or they want to have kids, and I'm just afraid of this. So I educate them and tell them like, hey, you can still have a baby.
Absolutely.
Like, and so then when I tell them like, okay, let's do these care plans, and like let's do this. Let's get yourself let's get your viral load undetectable. Let's get that. Let's stay on a healthy. Like, try to take your medications. Like, if you're wanting to go have kids, like, hey, you have the same opportunity as anybody who is not living with HIV to have a family.
Absolutely. I love that you're sharing that message, because the idea that stigma could prevent someone from having a family, right? Because maybe they're worried about transmitting the virus to the baby, right? So maybe they're worried about transmission, which we can control. But sometimes it's deeper than that, right? People get the message that my body's not safe, my body's not, quote, clean, right?
Yeah.
People feel that they don't have what it takes to be a great parent. But lots of people living with HIV are great parents.
Oh yes, I know a lot of my friends that are living with HIV are amazing parents. And you know, like that word that you just used, the word clean, you know, and it's crazy because in this time still, I see that word.
Right.
And that's huge stigma word,
Exactly.
the word clean. And it's very offensive because it's something that was created by beginning of this epidemic.
Mm-hmm.
And when I hear other people use that word, I hear them use the word, are you clean? And or they tell somebody, or if I've heard some say, oh, that person's not clean. I'm like, that is hurtful.
That is very stigmatizing.
I'm not, like I said, like, I'm not living with HIV, but that's hurtful to me
Right.
to say that. That's offensive. And using those and when I hear that, I do tell people, I am very unfiltered. Very fucking unfiltered.
I love that about you.
and it was crazy because this leads back to an experience. So I was at the Capitol. I was at the Capitol for HIV Advocacy Day this year. I think it was, oh my God, I'm so bad at my month. I think it was like the beginning, somewhere in March. I think it was March or February. I am so sorry, guys. Don't judge me for this. But I was at HIV Advocacy Day in Austin, and there was somebody in my group. I'm not going to mention names because that was addressed by somebody who I was on my team, who I respect, and he was so fun to work with that day. But we did have somebody in our group that had made a comment of using these type of words, and it's like, how do you want us to end the stigma when you as an advocate are still using it? It's not okay for you to use these. We cannot go up to these lawmakers and these senators and talk about doing change when some of us are still the problem. We're still using these words, and like those things are like that hurtful. And I remember they like got into it. And I told my new friend, I'm like, I support you because I stand by you on that. It doesn't matter what your age group is. Like, to me, if you're in this community and an advocate, especially, because you know what, I'm not gonna pretend like I haven't done some dumb shit or said some dumb shit. I have.
I think we all
I've used it. Like, you know, I'm being a Latina. I grew up in like with Latinos and like the African American. I used to use the word, not the hard word, like the hard N word, but the other one. It's more. And I had my friends who checked me on it, and at first it wasn't like, oh, it's not a big deal to me. Like we use that word as Latinos. We use that word, not the hard R word, but the other one. And it was a word that we would use a lot in how we refer guys, like hookups to. So it's a hookup word, like we would use for guys. But then I realized, I'm like, wait, I can't, like, when my friends called me out on it, and they were like, Rain, you can't be using it. You're an advocate. Like, you're still, and I didn't realize, I was like, well, I grew up with it. Like, yeah, but it doesn't matter. Like, if you're an advocate, you're using these type of words, it's still saying as, like, if you're saying the hard R word. And I did a lot of self-reflecting. I'm like, holy shit, like, it is bad as it sounds. So when I saw, like, that issue in Austin, I'm like, it reminded me of my own experience because I was being that person. And I was using this word freely with my friends. And I'm like, okay, I need to get away from that word. I didn't grow up in the hood anymore. So I gotta stop using that word. And as an advocate, I have to, like, present myself, like, in a professional way and still, and, like, get away from words that are hurting others. So using words like that, like you said, the word clean, it's very hurtful to people, and that's why I feel like a lot of people nowadays are scared to talk about their status, even though there's medication out there, certain words would trigger somebody from not wanting to get help.
Absolutely. You know, and I think of like hearing what you're saying, I think of a couple things. And the first thing is the way in healthcare spaces we often intentionally or unintentionally perpetuate that stigma. So when you listen to the stories that are recorded in HIV Out Loud, you're going to hear storytellers talking about experiences where, you know, they went to an ophthalmologist, an eye doctor, and when the doctor realized that they were living with HIV, the doctor, you know, double gloved and put on a mask and, you know, did all of this stuff to do an eye exam, right? So it's unnecessary. And the patient, like the person who's sitting there, knows that that means the doctor thinks that they are not safe, that the doctor thinks that the doctor, is at risk from caring for this patient. Like that gives a very clear negative message in what should be, and I know this maybe sounds like pie in the sky, but I really believe that every encounter with healthcare should be a healing experience.
Of course.
It should be a healing experience and not an experience where you go away thinking, like feeling bad about yourself or feeling judged.
Exactly.
So part of what HIV Out Loud is doing with sharing these stories is saying to the healthcare community, here's some ways that we can do better. And these ways are being suggested by our storytellers. They are from lived experience. It is important for us to reflect on our actions and our words so that we can do a better job. Because just like you say, people will avoid care. People will avoid medical spaces because of these stigmatizing experiences.
Yep.
So we need to do so much better. And then the other thing I think about is like some of my students who come into this course are nervous about interacting with the community, right? So maybe they're worried that they're going to use the wrong pronouns for their patient. Maybe they're worried that they're going to say something inappropriate without meaning to. Maybe they're worried they're going to use the wrong language. And what my experience has been is when I have put my foot in my mouth, right? When I have used the wrong language, when I have used stigmatizing language, the community has been very generous with me about saying, hey, say this.
Yeah, say it
right?
like, yeah.
Hey, do it like this. That's an act of generosity that helps us be better.
And I agree. Like, it's crazy because I actually talked about this with one of my friends earlier today, actually, before we met up. I told him, we were talking about pronouns, and I think, and as me as a trans person, people sometimes misgenderize me, and I'm okay with that. I don't get offensive. And for my brothers and sisters out there who are listening and who do get very offended by it, I think it's our job to educate people who don't understand. Because remember, there's people out there that have never met a trans person, so they're not going to know what a trans person is or how a trans person should or shouldn't look like. I just think that as people in our community, if we are wanting people to change or respect our pronouns or respect us as in general, we also have to do our part in educating them and be like, hey, well, I'm transgender and this is my preference, instead of being so offensive and getting upset right away. Because I've seen it in my community all the time. People get so offended, but it's like sometimes these are people meeting for the first time, so they're not going to understand it. So you got to be more understanding of it. Well, and not be so offended by it.
Well, I think that is like an act of generosity. I really do. And the thing about healthcare is when that comes up, like historically and traditionally, we think of healthcare as this space where there's a really strong power dynamic, right? Where the physician, the medical team has access to these resources that people need to be healthy and people need to survive, right? They need these resources. And so that the healthcare team or the physician has this power over patients. So when you're in an environment like that, where there's a power dynamic or it feels like there's a big power differential, I think that it's incumbent on the health team to try really, really hard to do our very best to be warm and welcoming and to use language that is not offensive to people,
Yeah.
right? So when we are corrected and when we are helped out and when we learn to do better, I think that is so generous. But I also think that because of where we sit in that room, because of the resources that we hold, and the roles that we occupy, we need to be the ones like bending over backwards to help people feel comfortable and welcome, especially when we're talking about people who had to pump themselves up, put on their, courage
Their
face,
armor.
put on their armor just to walk in the door.
Yeah, because it is very nerve-wracking. As like somebody as a trans person, like I remember like I get nervous.
Mm-hmm.
I get very nervous, even here like in public places, like. Excuse me. Even like in public places, like if I go to the restroom, for example, like I get nervous at times because of now the way society is, and I'd rather like I'm the type of person I'd rather not like I don't like causing scenes or anything. So if I feel like like maybe on a bad day I'm not wearing no makeup, no nothing, I was like I'm just gonna go to whatever bathroom I go, and I done it. My friends would be like, why are you walking into the boys' restroom? I was like, well, because today I feel like a boy, because I'm dressed like real urban. My style of clothing choice is very urban. So there's times where people be confused. They're like, are you a tomboy? Are you a girl? Or whatever. And I'm just like, I don't know. I just wish that we lived in a world where all this hate and misunderstanding would like people just like open their minds and be understanding of others.
Yeah.
And even if you don't like them, like I tell people, you don't have to fucking like me. At the end of the day, if you want me to respect you, we should be adult enough to respect each other at bottom line.
Yeah.
And you may not have the same views as me, and I don't have the same view as you. That's fine. As long as we can interact and be respectful of each other, that's all that I give a shit about.
Totally.
And, and going back to, doing HIV Out Loud, like, it is very important because my brother, when he came out to me and told me about his status, I asked him, okay, I'm going to your appointments with you. And he was like, you're really gonna go with me? I was like, yeah, what the hell? Like, you're my little brother. Like, I'm not afraid of it. Like, I'm not. So I started going with him, and I saw how some of a doctor he had, I can't remember his name, but even if I did, I wouldn't mention his name. But this doctor, when the first visit I ever went, that was the first and the last visit he ever went there. He was seeing that doctor for a while here in San Antonio. The doctor treated him like he had my brother sit in the corner of the room while he was closer to the door area, like wherever the sink was, and he looked at my brother like so disgusted. And he just kept saying like these words that he was using. And I'm somebody, I get gaslighted real quick. I go from a 0 to 1,000, especially when it comes to my loved ones.
Yeah. And
he was telling my brother, well, no one told you to get HIV, and no one. And
what?
I was like, hold the fuck up. I was like, what did you just say?
That's
and
totally
I was like, you know what? I was like, my brother does not need this shit.
Yeah.
I was like, I'm so glad, JP, you told me to come with you. Because now that I see you're getting treated, this is how you're getting treated. And from that day, I told my little brother, we're going to find you an organization, and I'm going to get you the right help. There has to be organizations in San Antonio that are dedicated to the HIV community. And that is exactly what I did. I found an organization, and that's how I started to get involved. I remember asking the supervisor there, who ended up now being one of my best friends. Mm-hmm. I asked him, like, hey, are you hiring? And I told him why my little brother was getting all his intake done, and he was getting tested by one of their linkage specialists. I was telling my now best friend Jojo, I was like, hey, I was like JP, this is the experience he's having with his doctor, and I was like, now that I know his status, I want to be more involved in his life. I want to make sure that my brother doesn't get the care that he wants. That he needs. I'm like, do you have any openings? And he's like, well, we do have an opening for a tester. And that's how I got my foot in the door into the HIV community. I became a tester. Awesome. But then it just so because unfortunately 3 months after that, my brother unalived himself. And it was really hard, but I made a commitment to him. And I made a promise that I would make sure that I could help as many people in our community get the care they need and not feel like another JP.
Exactly.
Because the doctors that day was very it was so disappointing to see that. And
Yeah.
I'm like, no.
So one of the things that I hear from storytellers that I think is really important is that, first of all, exactly like you're saying, there are spaces where you can get care that's respectful. Like, you can get care where you are recognized as a human, you get the medicines that are going to help you live your best flourishing life, and you can be yourself, right? There are those safe spaces in medicine. One of the things that storytellers remind me about is that people living with HIV don't just need their primary internal medicine doctor, but they may need an ophthalmologist, they may need a urologist, they may need other kinds of different doctors across medical specialties. And often it's when people go for that specialist care that they run into somebody who is just not as educated and not as well equipped to care for people living with HIV. So with HIV Out Loud, it's open to all the medical students, and my students go into OB-GYN, they go into family medicine, they go into internal medicine, you know, some of them are surgeons and specialists and or pediatricians, and I love that because yes, we need those internal medicine doctors who are the primary care providers for people living with HIV to be their best selves, but we also need every single medical space that somebody might access to be safe, warm, appropriate, and healing.
Yeah, and I feel not just with HIV, I feel that any medical space should be a safe space, no matter from like who you are, what color you are, where you're from, or what kind of viruses or chronic illness that you're dealing with. It should be a space that, because y'all, like, the doctors are the professionals here. We don't know of so many things, like, and we're coming to y'all because this is who we like. This is the advice that we need from professionals, and for us, and I feel this is why a lot of people fall out of care. When you go into, like, my brother is a perfect example. When I saw how he got treated, it's like he didn't want the care no more.
Right.
And with his other medical chronic, because my brother was diabetic as well. He had also another, I can't remember the name of it, but it had to do with his stomach, and he had with like intensive. He has like so many. It was called something with the gastric. I can't remember it, but he had other complications. So with that, having to deal with that health issue, and then HIV, and he fell out of care. He stopped. He gave up, and it turned into AIDS, and he didn't care. So that's why with HIV Out Loud, like, I believe so much in it, and I will stand 100% behind it, because what you're doing is amazing. You're opening a space to all different students of medical field, because like you said, they're going to different spots, and we need that same type of treatment all across the board.
Absolutely. You know, and I love you saying that about that it's for everybody, right? Because, you know, as a woman, I've walked into healthcare spaces feeling afraid, right? Feeling like I'm going to be judged. I think that also like HIV Out Loud, we're starting to do some storytelling work with women who had opioid use disorder, other people who were pregnant who had opioid use disorder during pregnancy. And so that's another group of people who really need amazing medical care, but who go in feeling shame, and that shame gets so much worse if they encounter stigma in healthcare space. So it's like the hope is that, you know, we train our students to serve as listeners. So it's medical students who are recording the stories, and that means that they have to sit down from 45 minutes to 3 hours, however long the storyteller wants, and really listen carefully and thoughtfully to another human being. So it's a kind of listening that is radically different from most of the listening that they've been trained to do in medical school, where they're listening to get the right diagnosis. They're listening to extract certain kinds of information.
Yes.
When they serve as listeners to HIV Out Loud, they're there to honor the story and to record the story. And I truly believe that learning to listen with that kind of fullness and that kind of interest just in the human being, not trying to extract a diagnosis or extract a particular piece of knowledge, but just to hear the story, I think that should change how they approach listening in medicine every single day.
I agree. I 100% agree with that. Like, I think it's going to be something very successful and impactful in our communities all across, not just LGBT, everyone.
I hope so.
And that is like, I strongly believe in it, because that's what we need. We need advocates that are going to be advocates for everyone. Mm-hmm. And that's why when I created Unfiltered Wings, I had told Mario, like, I'm dedicated to HIV and transgender community, but I'm also an advocate for all communities, not just one. Like, I want to represent everybody and be an advocate for it, because it is important. There's so many things that are out there that people are dealing with, and having safe spaces and having these advocates that are not afraid to speak up. Like, I'm not afraid to speak up. I am very open about it, and it's important. And like I said, HIV Out Loud is something, I think it's amazing, and I can't wait where it goes, like, in a few years from now. But, like, it's going to be amazing, because then we're going to have so many more storytellers. And I feel like this is a way, it's also a healing. Like I said, like creating my podcast is a way for me to heal, to deal with my tragic losses that have happened in the past 5 years. So I know storytelling, because I remember when Brittany sat with me, I had a relief of all that I was bottled up, all the emotions that I was going through from my brother's loss. Mm-hmm. And I believe I cried on that interview. Mm-hmm. I really opened my heart, and I hope that and you know what? And for a moment, I had forgot about that interview. Yeah. Until I was like, the interview, and I was like, oh my God, Brittany. Did. I was like, oh my God, I remember I did that one, and I'm glad, like, it helped others understand and see an insight of what my life is, and how, like, dealing with somebody who that I lost due to HIV, and I'm hoping, like, this platform and this and HIV Out Loud really helps, because those students can then pass that knowledge to other people they're going to work with, who might be somebody who has very close-minded and has a certain set view of how they treat certain people. And I think this is going to make them amazing doctors and providers and every part of the medical field. And I think it's going to take time, to take a lot of work.
Totally.
But I know eventually we may not be here by the time we see that, but I hope one day that we get that the world has changed to a more positive and a more loving, because you know what, in this world, everyone deserves a chance at love.
Absolutely.
It really does. That's why I feel like I have such a huge heart, and I love being around people who are positive and that make a huge difference. All the people that I surround myself with are positive changers. They're advocates in different parts of the community, not just in HIV. I have some that are advocates for the houseless community, for our human rights, from just every part of the spectrum. Yeah. And it's important.
And I got to experience that personally when you came and spoke with the class, because what you did is you really transformed the classroom space into a space that was welcoming for everybody. You shared about your story, and you shared about what you're hoping for the healthcare system to be like, but you also went around and you asked every single person in the room to share about who they were and why they were there. And what that did was it built community right there in the room. And it was so beautiful and so powerful. And that's what I want for that student who's like, oh, I'm worried I'm going to say the wrong thing, and where that nervousness forms a barrier to interacting, right? That forms a barrier. You just like welcomed everybody. And I think that it helped my students get to that place where, like, oh my gosh, when they find out they're caring for, a patient who's trans, they're going to be like so excited, right? And excited to
I'm glad.
Welcome them.
I thought it was very important for me as an advocate. I thought it was very important for me because it's not just about me. It's about the people that I also work with and the other advocates. And that's why when I asked that question, I wanted to know their backstory. What drove them? So I guess now I'm going to ask you that question. What drove you to be the person you are today?
Oh my gosh. Wow.
You open that kind of worms.
Okay, I'm going to try to answer this. So I come from a family where storytelling is just part of our culture.
It's powerful.
Like when we get together, we just sit around and tell stories and try to make each other laugh. And it's like a core part of who I am. So coming into healthcare, when I started as a med student, I was in Galveston, and I was shocked at how poor people from working class families, were so often denied like the basic things that they needed to be healthy. Access to medical care, safe housing, right? Safe neighborhoods, good education, healthy food. It was just like, it was shocking to me, because like the people who went to the free clinic in Galveston, they were just like my family, you know? They were just like people I would know and would hang out with and loved. And then seeing that they were left to suffer from treatable diseases, that they were denied access to medical care, it really shook me. I knew that that was true in my head. Like I knew it was true, but actually engaging so deeply in their stories really sort of lit a fire under me. And that was when I started using storytelling as a tool for advocacy in medicine. I started writing about what my patients were experiencing, like with their permission and their collaboration. And that's when I really recognized, okay, if I, Rachel, am gonna do everything I can possibly do to make a better world, storytelling has to be part of it.
It's powerful, really powerful.
Yeah.
I learned that throughout the years that storytelling is powerful. It's knowledge too. And it really connects you with those individuals that are battling with different things.
Yeah.
And that's why, like, I love this. Like, that's why when I first met you, it was like amazing. I was so excited. I told my whole team, I'm like, we're going.
Yes,
I'm like,
you brought your whole team. It was awesome.
I told my team, we're going. Like, I believe in, because this is where it starts. And so thank you for what you do. Like, I think it's amazing, and to know that is what like drew you to be where you at now. Like, you get to help thousands of people in our community. San Antonio is lucky to have an amazing doctor and a professor here.
You're so sweet.
Like, Houston, you lost somebody good. But it's okay, we gained her over here. But I think it's amazing. Like, that's awesome. I'm glad, and you have such a big heart. Like, when my parents passed away, you were there. Like, it was amazing. Like, it was. I appreciate that. Like, it's hard when you get to meet really genuine good people. So thank you. So I really appreciate everything you do for our communities, for our people in the city of San Antonio. Like, and sometimes a lot of people don't get to know our backstories from these doctors and our providers. So that's why, like, I was excited to have you on my podcast today. I was like, I want her Unfiltered Beauty today. Like, when we were talking yesterday, I was like, and you've been on my list of all the speakers that I'm reaching out to, but you were one of like the first ones, because HIV Out Loud has been in the back of my mind, because it's something that I really strongly believe in, and it's something that you're right. Storytelling is a very powerful thing, and this is a way of advocating. Because we're making sure and helping that these students go out into the world and spread nothing but love and acceptance and open mind.
Exactly.
So thank you for what you do.
Oh my gosh, well, thank you for what you do, Rain, and thank you for being a part of it from the very beginning. You are impacting people's lives. You're impacting these future doctors. You're impacting the spaces that they're going to create, and every single patient that they're going to care for. So it really matters so much. And like, honestly, what I have been able to experience working with HIV Out Loud and being in the community and connecting with organizations like Living Positive and like other organizations here in San Antonio that are serving the community has just been like such a kind, warm, generous welcome. And to get to experience that has made my life so much richer. It's like, I think if people aren't caring for the trans community, if people aren't caring for people living with HIV, if people aren't like engaging in the community that's around them, then they're missing out, because it's awesome.
We're a big old party in our LGBT community. We're nothing but love and acceptance. If anybody listening out there, our community, one thing I've always loved, and I mentioned this on my last episode with Raimi, is that our communities, we get to choose our own family. Even we get to choose our own family, and what makes it amazing is that even though you may not, your family not be in your life, or you know what, go out to the strip, go out to come out to our safe spaces, our LGBT safe spaces, and you'll meet somebody there that will become your family.
Right.
And that is what I love about our community, is that we're always gonna have our backs. We always have each other's backs, no matter we're going to be fighting with somebody, but when it comes down to protecting our own and protecting our people and standing up for what's right, you best believe we'll be side by side there with you.
That's right.
So, Dr. Rachel, this was an amazing, I had a fun, we didn't go off the questions that way, but you know what, I wanted to be more, I had questions, but you know what, I ended up staying away from the questions because I wanted to just get to know you more and have a conversation. And and the point is, like, HIV Out Loud, I think it's something that, like I said, I deeply connected with and I love, and I think I'm excited for what the future holds for HIV Out Loud, and I can't wait to see all these new storytellers that are going to be coming on board.
Yes.
And
and if I can just say, if any of your listeners are interested in sharing a story,
of course,
we're creating a permanent archive of stories of people living with HIV, family members, advocates, community members, to really build public knowledge of lives affected by HIV here in San Antonio and here in South Texas. So if folks want to get connected with the project, reach out to Rain, reach out to me. Like, we can connect you.
How can our listeners reach out to you?
Yeah, so probably the best way is email. So if you email, this is going to be, our email address is so bad. It's humanities. So humanities@utesca.edu. So it's UTHSCSA. UT Health Science Center San Antonio, uthscsa.edu, humanities@utesca.edu. Mention that you're interested in HIV Out Loud. I would love to connect with you. And we are working on having a social media presence and really moving the stories into public space. So that's one of our goals for the next year.
Awesome. Well, thank you so much. Thank you for this time with you. I didn't get to mention because we had to do like 2 retakes. We are at Luciano's at La Cantera. We're having an amazing lunch. So we are now going to enjoy our lunch. It's probably cold already, but it's okay. You know what? You know what keeps it warm? Our hearts.
Our love.
Our hearts keeps it warm. So Dr. Rachel, thank you so much for accepting my invitation to be on my podcast today. This is going to be fun. I can't wait till it comes out. And thank you for all the amazing work you do. It's not an everyday thing where you get to sit down with the doctor and talk about your life experiences. And I know we'll definitely have another conversation.
For sure. And
so thank you so much for what you do for our communities and for all of our people in San Antonio. We are lucky to have you as one of our doctors. So thank you so much, and welcome to your new home in San Antonio.
Thank you. It is
an
honor.
Thank you. Well, thank you, beauties, for being my followers. Thank you for being so supportive of everything that I do as an HIV and transgender advocate. I really appreciate y'all. It is Pride Month, so don't be afraid to be yourself. Don't be afraid to love who you love. And as I always say, unleash your inner phoenix.